Greetings dear viewers. In this video, I would like to explain about the mumps virus and its infections in human. I am Dr. M. Manikandan, Assistant Professor from the Department of Microbiology, Sacred Heart College, Tirupattur. Introduction. Mumps is an acute contagious disease of children characterized by acute enlargement of one or both salivary glands. Mumps virus is the cause of acute benign viral parotitis, that is painful swelling of the salivary glands. Mumps virus is a typical paramyxovirus possessing hemagglutinin, neuraminidase and F proteins. Mumps virus was first isolated in embryonated eggs in 1945 and in cell culture in 1955. There is only one serotype known to cause lytic infection of cells. Mode of transmission. The viral infection is transmitted by direct contact, airborne droplets or fomites that is contaminated with saliva and is also possible by urine. Closer contact is necessary for transmission of mumps. It is difficult to control transmission of mumps because of the variable incubation periods. There are large number of asymptomatic cases and virus may be present in saliva before clinical symptoms. Pathogenesis. Mumps virus causes a lytic infection of cells and humans are the only natural host. Once the virus enters the respiratory tract, the infection begins. The incubation period is typically about 14 to 18 days. That is, it ranges from 2 to 4 weeks. Primary replication occurs in nasal or upper respiratory tract epithelial cells. Once viremia occurs, virus is then disseminated to target tissues such as the central nervous system and salivary glands. Involvement of the parotid gland is not an obligatory step in the infectious process. The virus is spread by the viremia throughout the body to the testes, ovary, pancreas, thyroid, and other organs. The infection of the central nervous system, especially the meninges, occurs as many as 50% of those infected. Salivary glands show desquamation of necrotic epithelial cells lining the duct. The virus replicates in the target tissues and then causes a secondary phase of viremia. The virus then spread throughout the body to kidneys, testes, ovary, pancreas, and other organs. Infection of the central nervous system, especially meninges, causes meningitis or meningoencephalitis. The central nervous system is commonly infected and may be involved in the absence of parotitis. Mumps is a systematic viral disease with a propensity to replicate in epithelial cells in various visceral organs. Virus shed in the saliva from about 3 days before to 9 days after the onset of salivary gland swelling. Clinical symptoms. The clinical symptoms of mumps reflect the pathogenesis of infection. At least one-third of the all mumps infection are asymptomatic in nature. Majority of infection occurs in children under 2 years of age. The most characteristic feature of symptomatic cases is the swelling of salivary glands, which occurs in about 50% of patients. A prodromal period of malaise and anorexia is followed by rapid enlargement of parotid as well as other salivary glands. There are many clinical complications are observed in the mumps viral infection. The initial is the parotitis, in which swelling may be confined to one parotid gland or more than one parotid gland, which may enlarge one after another in several days differentiation. The gland enlargement is associated with pain and fever. Oral examination of this parotid gland reveals redness and swelling of the ostium of the Stenson duct. This next complication is the meningitis and meningoencephalitis, in which the central nervous system involvement is common in about 10 to 30% of the cases. The meningoencephalitis is usually occurs after 5 to 7 days of the inflammation of salivary gland. The mumps causes aseptic meningitis, which is one of the common manifestation. The third condition is the orchitis and ophoritis. The testes and ovaries may be affected, especially after puberty. 20 to 50% of men who are infected with mumps develop orchitis. Because of the lack of elasticity of tunica albigine, which does not allow the inflamed testis to swell, the complication is extremely painful. Ophiotitis mumps occurs in about 5% of women. Pancreatitis, which is reported in about 4% of cases. Deafness has been seen in 4% of cases, but it lasts for a short period of time. The other complications includes arthritis, nephritis, thyroiditis, mastitis, thrombocytopenia, pneumonia, myocarditis, and death due to mumps is very rare. Laboratory diagnosis. For the viral isolation and identification, specimens need to be collected of saliva, urine, the pharynx, secretions from the Stenson duct, and the cerebrospinal fluid. The specimens collected should be within 5 days after onset of infection. Virus can be isolated from saliva for up to 4 to 5 days, CSF for about 8 to 9 days, and from urine for about 15 days after the onset of symptoms. For the isolation of virus, the specimens has to be inoculated soon after collection of the virus, which is labile. The prepared specimen is inoculated into monkey kidney cells, human amniotic cells, HeLa cells, or 6 to 8 days old chick embryos by the amniotic route. Virus growth can be detected by heme adsorption and identified by heme absorption inhibition using specific antiserum, and the formation of multinucleated giant cell is a major cytopathic effect seen in viral cultivation. The serological identification includes the detection of mumps-specific IgM antibodies, in which fourfold rise in antibody titer is the evidence of mumps infection. Presence of antibody to V antigen is indicative of past infection, and that of S antigen indicated recent infection. The other techniques used for viral identification are the ELISA, complement fixation, immunofluorescence, and hemagglutinin inhibition are commonly used. The RT-PCR is very sensitive method. PCR assay can identify virus strain and provide useful information in epidemiological studies of the mumps infection. Treatment and prevention. There is no specific antiviral drugs are available for mumps viral infection. The vaccines provide the only effective means for preventing the spread of mumps infection. An effective live attenuated vaccine is available against mumps viral particles. The vaccine consists of geril-lin strain of mumps virus, which is attenuated by serial passage in eggs and chick fibroblasts. Mumps vaccine is available in combination with measles and rubella as MMR, which is a live attenuated vaccine. The vaccine is given as a single subcutaneous injection, and 2 doses of MMR is recommended for school-going children. Since the introduction of vaccine in the United States in 1967 and its administration as a part of MMR vaccine, the yearly incidence of infection has declined from 76 to 2 cases per 100,000. I wish to thank you for your patient listening and kindly subscribe to our channel. Encourage us by your comments in our comment section. Thank you all.